Hello everyone, myself Dr. Kewal Gangrade, working as a orthopedic trauma and arthroscopic surgeon, Bansal Hospital, Bhopal. Today is 20 October, which is being observed as World Osteoporosis Day. The purpose of World Osteoporosis Day is to increase awareness among public regarding how to prevent osteoporosis and how to manage the osteoporosis. So osteoporosis, it is basically a weakening or fragileness of the bone, where the bone become very weak or fragile and they get fracture even after a minor fall or minor trauma. So normally we get patients who suffered hip, spine or wrist fracture due to severe osteoporosis in the bone, which is due to basically imbalance in the bone formation and bone remodeling phase. In osteoporosis patient, the bone remodeling phase is being disturbed. That's why the patient suffer from osteoporosis. The major risk factors for osteoporosis, the patients who are at risk of osteoporosis are the patients who are of age more than 50 years are usually at risk, especially the women are at a higher risk of osteoporosis. The weight of the patients who are undernourished or underweight are at higher risk of getting osteoporosis in the future. The other group, the person who are not following the good dietary habit or lifestyle or genetic factors plays an important role in causes of osteoporosis. The few other persons who belong to medical conditions like chronic kidney disease, digestive tract disease, thyroid or lung issues are also suffer from osteoporosis. The persons who are on the few medications like steroid medication, chemotherapy, immunosuppressant or anti-epileptic medications are also at the risk of osteoporosis. So these patients should get proper orientation or proper consultation in order to prevent the osteoporosis or get management accordingly. How to prevent osteoporosis? The persons who are at risk group of getting osteoporosis, they should follow good dietary habit, lifestyle modification in order to get protection from osteoporosis. The dietary habit should usually include the food articles which are rich in calcium and vitamin D supplements like milk or dairy products, fruit, green leafy vegetables, cereals or fruit nuts, which are rich source of calcium and vitamin D. If one is non-vegetarian, they can go for egg or seafood supplements in order to get adequate quantity of calcium in the body. The normal requirement for calcium in age group 18 to 50 years of age is around 1000 milligram per day, while vitamin D requirement is 600 international unit per day. And the person who are of age more than 50 years, they require higher quantity of calcium like 1200 milligram per day and vitamin D supplements 800 international unit per day. So if one is getting enough calcium and vitamin D supplements from their diet, they can continue with the same diet protocol. Otherwise they should consult doctor in order to get adequate treatment addition or supplements in order to prevent osteoporosis. Other thing, the lifestyle modification, the one can go for regular exercise protocol like 30 to 40 minutes per day of exercise is good enough to prevent osteoporosis. For management part, the osteoporosis, the patients who suffer from osteoporosis symptoms or they have recent history of osteoporotic fractures, they should consult the orthopedician in order to get proper treatment of osteoporosis and prevent the fracture risk in them. So normally the vitamin D, calcium considered as a main part of treatment, but in addition few other medications are being prescribed like bisphosphonate, recombinant parathyroid and denosumab. These medications work by either reducing the bone resorption or increasing the bone formation activity. So would like to conclude as the persons who are at risk of osteoporosis, they should follow a good dietary habit and lifestyle in order to prevent the osteoporosis, and those who already are suffering from osteoporosis or have symptoms of osteoporosis, they should consult a doctor in order to get proper guidance regarding the osteoporosis and medication protocol. Thank you.